Hi, I'm Lisa Washburn, Community Health Specialist and Associate Professor with the University of Tennessee Extension. I'm part of the Professional Development Team for the Well-Connected Communities Project. I'm happy to share with you today a module developed to help you understand chronic disease risk factors and simple strategies for prevention and management. 6 in 10 adults in the United States have a chronic disease. These conditions are the leading causes of death and disability and the leading drivers of the nation's healthcare costs. The good news is that 70 to 90% of chronic disease risks are related not to genetics or heredity, but to lifestyle and environmental factors. In this module, you'll learn the basics about common chronic diseases, like diabetes, hypertension, and heart disease. We'll talk about risk factors, prevention, and chronic disease management. Specifically, in the chronic disease module, you'll learn about the chronic disease burden in America, common risk factors for chronic disease prevention, and also strategies for managing chronic disease. The definition for chronic disease varies slightly, depending on the federal agency or organization. According to the CDC, chronic diseases are defined broadly as conditions that last 1 year or more and require ongoing medical attention, or limit activities of daily living, or both. The National Cancer Institute definition of chronic disease is a disease or condition that usually lasts for 3 months or longer and may get worse over time. Chronic diseases tend to occur in older adults and can usually be controlled but not cured. The most common types of chronic disease are cancer, heart disease, stroke, diabetes, and arthritis. In general terms, chronic diseases are defined as illnesses that last a long time, do not go away on their own, and are rarely cured. Chronic disease is the leading cause of death and disability in the United States. 7 out of 10 deaths among Americans are from chronic diseases. Heart disease, cancer, and stroke account for more than 50% of deaths each year. The Centers for Medicare and Medicaid Services reference 19 chronic conditions. They are Alzheimer's disease and related dementia, arthritis, including osteoarthritis and rheumatoid arthritis, asthma, atrial fibrillation, autism spectrum disorders, cancer, chronic kidney disease, chronic obstructive pulmonary disease, depression, diabetes, heart failure, hepatitis, HIV/AIDS, high cholesterol, high blood pressure, heart disease, osteoporosis, schizophrenia and other psychotic disorders, and stroke. Nearly 60% of adults in the United States live with at least one chronic condition. 42% of adults have more than one chronic condition. 1 in 2 U.S. adults, or 50%, report having at least one of 6 chronic illnesses. Those 6 are heart disease, cancer, chronic obstructive pulmonary disease, also referred to as COPD, asthma, diabetes, or arthritis. This module focuses on 3 chronic conditions: heart disease, diabetes, and stroke, with a focus on hypertension as a stroke risk factor. To start, let's think about chronic disease risk factors. Take a few moments to jot down every chronic disease risk factor you can think of. When you're finished, take a look at your list and label each risk factor as something that can be changed or something that cannot be changed. I'll give you a few moments to do that. We'll talk more about risk factors you can change and risk factors you cannot change later. The risk factors for chronic disease are many. Risk factors shared in common for diabetes, heart disease, high blood pressure, and high cholesterol are being overweight or obese, being physically inactive, having a poor diet, excess stress, smoking, your age, family history, and ethnicity. As you can see on this table, the check marks go across each disease and each risk factor. Additionally, each condition or chronic disease is a risk factor for others. Said another way, if you have diabetes, you are at increased risk for hypertension and heart disease. There is a cumulative effect. It's important to know what your risk factors are and to know that some risk factors can be changed, but others cannot. Of the risk factors displayed here, are there any that can be changed or controlled at the individual level? All can be addressed individually to some degree. Which risk factors can be somewhat controlled at the individual level, but might also be impacted by environmental factors? One example is a high-salt diet. Someone with a low income may have limited food dollars and be inclined to purchase high-salt foods because they are less expensive. Some examples are fast food, potato chips, and even some processed foods that do not taste salty. A second example of a risk factor impacted by external influences is excess stress. You may recall the social ecological model and the concept of social determinants of health from another module in the Well-Connected Communities series. Chronic stress is associated with excess stress. Some types of stress are acute or occur suddenly then subside, like the stress you might feel when you are about to be late for an important meeting. In contrast, chronic stress persists for a long period of time. We know that people with lower incomes and fewer resources, and those who are ethnic minorities, may experience chronic stress that harms their health over time. For some individuals, taking steps to reduce excess stress may not make much of an impact on this risk factor. We can all learn to manage our stress better. But the main idea is that some of the controllable risk factors referenced here are not completely within an individual's control. When we are making plans as volunteers to help address these issues, we need to keep this in mind. Risk factors on this slide are associated with heart disease and hypertension, or high blood pressure. We'll address hypertension and stroke next. Next, we will discuss a specific chronic disease and a contributing factor: stroke and hypertension, or high blood pressure. Hypertension and high blood pressure are the same thing. High blood pressure is a major public health issue, as the United States map on this slide shows. States in the darker colors have higher rates of high blood pressure among adults. Can you find your state on the map? How does your state compare to others? And do you see any geographic trends? Uncontrolled high blood pressure can injure or kill you. It's called the silent killer because it has no symptoms. Many people don't know they have it, so it's very important to get your blood pressure checked regularly. You might notice that states in the southern U.S. have higher rates of high blood pressure than some of the other regions. High blood pressure is a major risk factor for stroke. The next slide will show stroke death rates. This map shows stroke death rates among adults aged 35 and older in the U.S. Unlike the map on the previous slide, it is divided by state and by county. You may be able to find your county and state. Counties coded with darker colors have higher stroke death rates than counties in lighter shades. Can you see a pattern or similarity between this map showing stroke death rates and the previous slide, which showed high blood pressure? There is a pattern of higher death rates in states with higher rates of high blood pressure. High blood pressure is a big deal. Age is a risk factor for high blood pressure. Is age a risk factor you can change or a risk factor you can't change? You cannot change your age, so the increasing rates of high blood pressure as we get older should be of concern to everyone. Among those aged 55 and older, more than half have high blood pressure. You probably had your blood pressure measured the last time you went to the doctor. Maybe you've used one of the automatic machines at a pharmacy. Have you ever wondered why the blood pressure cuff inflates on your arm and how that measures blood pressure or what the numbers displayed mean? First, blood pressure is the force of blood pressing against the walls of the arteries that carry blood away from the heart. Think about a water hose. Have you ever used a water hose that didn't have good pressure and the water just trickled out? What about a hose that had really high pressure and was hard to handle? That relates to the pressure of water moving through the hose. The force of blood moving in your body is sort of similar. Blood pressure is recorded as two numbers, systolic and diastolic. For example, 120/80. When the heart beats, blood is propelled out of the heart into blood vessels called arteries. Blood pressure is the force of blood pushing against the walls of the arteries. Systolic pressure is the top number in a blood pressure reading. Blood pressure is highest when the heart beats and blood is pumped out of the heart into the arteries. Diastolic pressure is the bottom number in a blood pressure reading. Blood pressure is lowest in between heartbeats when the heart is at rest. One way to remember the difference between systolic and diastolic is that diastolic is down, the bottom number, and is also the lowest number in the reading. Diastolic and down both start with the letter D. Hypertension and high blood pressure are the same thing. Hypertension is blood pressure that is persistently higher than the recommended blood pressure range. High blood pressure increases your chance for getting heart disease and kidney disease or having a stroke. Hypertension is a blood pressure reading more than 140/90. About 1 in 3 Americans have high blood pressure. Once it develops, it usually lasts a lifetime, but it can be treated and controlled very well. Hypertension is a silent killer because it may be present for years without symptoms. If hypertension isn't diagnosed at an early stage, people won't find out about it until they have trouble with their heart, brain, kidney, or blood vessels. Children are impacted by high blood pressure too. According to the CDC, about 4% of youth aged 12 to 19 have hypertension, and another 10% have elevated blood pressure or prehypertension. youth with obesity had the highest prevalence of hypertension. This slide shows blood pressure ranges. You'll see that normal blood pressure is less than 120/80. Someone in the pre-hypertension range should pay close attention to their blood pressure, monitor it regularly, consult with their healthcare provider, and make lifestyle changes to reduce controllable risk factors. Those with blood pressure levels that put them in the stage 1 or stage 2 categories should be under the care of a healthcare provider. Treatment will likely include medications and lifestyle modifications. It's important to note that someone with pre-hypertension can avoid advancing to the hypertension stage when medication is required if they make lifestyle changes now. This slide shows blood pressure ranges for different systolic and diastolic readings. Some people think that blood pressure is considered high only if the top number, the systolic number, is above the recommended range. However, a person could have elevated blood pressure with only the bottom number, the diastolic reading, above the recommended range. It's important to pay attention to both numbers, top and bottom. Having high blood pressure makes the heart have to work too hard. The pressure of blood against the walls of the arteries makes them rigid and hard instead of flexible and healthy. The arteries throughout the body can become narrow and lead to a reduced blood supply to the heart, a heart attack, or to the brain, a stroke, or to the kidneys, which will make a person need dialysis. Reduced blood supply to the legs can lead to gangrene and amputation. As you can see, the consequences of high blood pressure that is not treated or controlled well are very serious. Uncontrolled or untreated high blood pressure can lead to aneurysms or bulges in the large blood vessels of the brain, intestine, legs, and aorta. These bulges can rupture, leading to severe consequences, including death. Anyone can develop high blood pressure. You might recall from a previous slide that age is a risk factor. African Americans are at high risk for high blood pressure. They get it at younger ages and more often than their white counterparts. Older adults are more likely to have hypertension. 60% of Americans over age 60 have it. Being overweight and having a family history of high blood pressure puts you at increased risk. And having blood pressure above the recommended range at the pre-hypertension level puts you at increased risk. Pre-hypertension can be treated with lifestyle modifications, but a person with stage 1 or stage 2 hypertension will likely need to take prescription medications, plus make lifestyle changes. Being overweight or obese is a major risk factor for high blood pressure. It's estimated that 75% of men with hypertension and 65% of women with hypertension can directly attribute the condition to carrying extra weight. Being more physically active can help with weight loss. Drinking alcohol in moderation and reducing salt and sodium are also recommended lifestyle changes. Let's talk more about limiting sodium. Most Americans, both adults and children, consume too much sodium each day. The dietary guidelines recommend no more than 2,300 milligrams per day. People with hypertension and pre-hypertension can benefit from reducing sodium to 1,500 milligrams per day. And according to the American Heart Association, limiting sodium to 1,500 milligrams per day for all adults, even those with healthy blood pressure levels, is ideal. The average daily sodium intake in the U.S. is 3,400 milligrams. Reducing sodium intake by 1,000 milligrams can help, even if consumption exceeds recommendations. The key message is that nearly everyone can benefit from reducing sodium intake. We've talked a lot about high blood pressure and how to prevent it or reduce your risk. One of the biggest health risks of having high blood pressure is that it increases your chances of having a stroke. A stroke is a brain attack caused by a blood clot in the brain that blocks blood flow. Permanent brain damage can be avoided or reduced for the most common type of stroke with a drug called TPA, tissue plasminogen activator. The catch is that the stroke victim must receive this drug within 3 hours of the stroke occurring. This is sometimes called the golden window. Research shows that giving the drug past the 3-hour window can increase instead of decrease damage. That's why getting to the hospital is so important. Unfortunately, the 3-hour window is often missed because it can be difficult for people to get to the hospital within 3 hours of the start of a stroke. They may not realize they're having a stroke, or they may want a friend or a family member to take them to the hospital instead of calling an ambulance. This slide shows how to spot a stroke using the acronym B-FAST. B stands for balance. A loss of balance, headache, or dizziness is the sign of a stroke. E stands for eyes. Blurred vision is a stroke symptom. F stands for face. If one side of the face is drooping, that could be a sign of a stroke. A stands for arms. Arm or leg weakness could be a sign of a stroke. S stands for speech. If a person has speech difficulty or is slurring their speech, it could be a sign of a stroke. And finally, T. T stands for time. Time to call for an ambulance immediately. Remember the 3-hour golden window. Next, we'll discuss heart disease. This map shows heart disease death rates for adults aged 35 and older by county. Counties in the darker shades have higher death rates than those in lighter shades. Do you see any patterns or trends on the map? How do you think this might relate back to maps showing stroke and high blood pressure rates that we looked at earlier? Where does your county rank compared to others in your state? What about compared to others in the nation? Let's start our discussion of heart disease risk factors by talking about cholesterol. Have you had your cholesterol checked? Having high cholesterol is a risk factor for heart disease. Atherosclerosis is a disease in which plaque builds up inside your arteries, limiting the flow of oxygen-rich blood to your organs. Some people call it hardening of the arteries. It limits blood flow and increases risk for heart disease and stroke. Plaque, which is cholesterol, calcium, and other substances, builds up in the walls of blood vessels. This can happen anywhere in the body. Coronary heart disease occurs if plaque builds up in the coronary arteries of the heart. The plaque buildup narrows the arteries and reduces blood flow to your heart muscle. The plaque can rupture and cause a blood clot to form. This further narrows the artery, and the process repeats itself. Over time, the artery gets narrower and narrower, reducing blood flow even more. When you get your cholesterol checked, you may get several different numbers. Your total cholesterol, LDL, and HDL. You may also get a number for triglycerides. People aged 20 and older should get cholesterol checked at least every 5 years. Total cholesterol should be less than 200 milligrams per deciliter. HDL cholesterol, or good cholesterol, protects against heart disease. So for HDL, higher numbers are better. A level less than 40 milligrams per deciliter is low and is considered a major risk factor because it increases your risk for developing heart disease. HDL levels of 60 milligrams per deciliter or more help lower your risk for heart disease. You can remember that HDL is the good cholesterol by thinking about H as healthy. HDL stands for high density lipoprotein. High levels of LDL cholesterol are harmful. You can remember LDL as bad cholesterol by thinking of L as lethal. LDL stands for low density lipoprotein. LDL is considered the bad cholesterol because it contributes to fatty buildup in the arteries. Remember hardening of the arteries or atherosclerosis from the previous slide? LDL cholesterol contributes to this. So unlike HDL, where higher numbers are better, lower numbers are better for LDL. Triglycerides can also raise heart disease risk. Triglycerides are a kind of fat found in your blood. A normal triglyceride level is less than 150 milligrams per deciliter. Levels that are borderline high, between 150 and 199, or high, 200 milligrams per deciliter or more, may need treatment in some people. High cholesterol is a risk factor for heart disease. Starting at puberty, men often have lower levels of HDL cholesterol than women. As women and men age, their LDL cholesterol levels often rise. Before age 55, women usually have lower LDL levels than men. However, after age 55, women can have higher LDL levels than men. So, based just on the LDL numbers, after age 55, in general, who do you think is more at risk for heart disease, men or women? The answer is women. In fact, heart disease is the number one cause of death in women. It also happens to be the top killer of men, too. But more women die from heart disease than men. 1 in 3 women die from heart disease. Other factors impacting cholesterol levels are diet, how much you weigh, how active you are, if you have a family history of high cholesterol, and of course, your age and gender. Now that we've talked about high cholesterol as a risk factor for heart disease, let's look at some other heart disease risk factors. The heart disease risk factors on this slide probably sound familiar to you. Most of them are similar to the risk factors for high blood pressure and stroke. Risk factors you can control are smoking, high blood pressure, high blood cholesterol and high triglycerides, overweight and obesity, physical inactivity, diabetes and prediabetes, which we'll discuss in a few minutes, and metabolic syndrome, which is the name for a group of risk factors linked to overweight and obesity. There are also heart disease risk factors that you can't control. One is a family history of early heart disease. Your risk increases if your father or brother was diagnosed with heart disease before age 55, or if your mother or sister was diagnosed with the disease before age 65. Another risk factor is age, being 55 or older for women, and a history of preeclampsia during pregnancy. Preeclampsia is the name for high blood pressure a woman gets while pregnant if she didn't already have high blood pressure. Other risk factors can contribute to heart disease, including sleep apnea, stress or depression, too much alcohol, birth control pills, particularly for women who are age 35 and older and who smoke, anemia, and an unhealthy diet. Your risk is multiplied when you have more than one heart disease risk factor. The risk factors do not add up individually like 1 plus 1. The combination of risk factors increases risk more than if they were present individually. For example, being overweight increases your chance of developing heart disease and your chance for developing high blood pressure. And high blood pressure increases your heart disease risk. Your risk skyrockets with each added risk factor. Most risk factors can be prevented or controlled. Family history, age, and a history of preeclampsia are beyond your control, but you can take steps to prevent or control other risk factors. For example, following a healthy eating plan and losing excess weight will help prevent high blood pressure. It will also help prevent high cholesterol, overweight, and diabetes. You can lower your heart disease risk by following a healthy eating plan. A healthy eating plan is low in saturated fat, trans fat, and cholesterol, and moderate in total fat. Include lots of fruits, vegetables, and whole grains, and low-fat or fat-free dairy products. Lean meats, poultry, fish, beans, and nuts should also be in your diet. As we already discussed, if you have high blood pressure, cut down on salt and sodium. If you drink alcoholic beverages, have no more than 1 a day for women or 2 for men. Lose weight if you need to, and keep a healthy weight. To maintain a healthy weight, balance the calories you take in with those you use up in physical activity. Having high blood pressure, high cholesterol, and diabetes increase risk for heart disease, but they can be managed through living a healthy lifestyle. I hope that by now you're seeing some common threads to prevent and manage chronic disease. If your doctor prescribes medication for diabetes, high blood pressure, or high cholesterol, be sure to take it as directed. Next, we will discuss diabetes. This is the last chronic disease we will cover today, and it's a big one. Diabetes carries with it complications that can negatively impact quality of life. Diabetes occurs when a person's blood sugar or blood glucose is too high. Foods that we eat are converted to blood glucose. Blood glucose is also made in the liver and muscles. The pancreas controls glucose in the blood because it makes insulin, and insulin unlocks the doors of cells so that glucose can enter and be used for energy. For some people with diabetes, the pancreas may not make enough insulin, or the cells don't allow insulin to open their doors. When this happens, glucose stays in the blood instead of being used by the cells. And when it isn't used by the cells, glucose builds up in the blood, resulting in high blood sugar, and that causes damage to the body. Normal blood sugar levels are 70 to 100 milligrams per deciliter when a person has their fasting blood sugar checked. You may have heard the term borderline diabetic or having a touch of sugar. Both are sometimes used to refer to a person who is pre-diabetic. This person has a blood sugar level that is higher than normal but not in the diabetic range. Pre-diabetes increases risk for developing diabetes, heart disease, and stroke. It's a warning that if lifestyle changes are not made, there could be serious health and financial consequences. Diabetes is expensive to treat. A person may be diagnosed with diabetes if they have readings of 126 milligrams per deciliter or higher on 2 separate readings. Some parts of the country have a higher burden of diabetes than others. This map shows diabetes prevalence among adults in the United States. States in red have higher prevalence than those in orange shades. Do you see any patterns on the map? How do you think this might relate back to the map showing stroke, high blood pressure, and heart disease we looked at earlier? How does your state compare to others in the nation? Diabetes carries serious health risks. It increases the risk of stroke, blindness, heart disease, kidney failure, and amputations. Diabetes comes with serious health risks and complications that can be avoided if a diabetic takes care of themselves, makes lifestyle changes, and manages their diabetes. The list of diabetes risk factors is long and includes several factors we've already discussed today. You are more likely to develop type 2 diabetes if you are overweight or obese, age 45 and older, have a family history of diabetes. You're more likely to develop type 2 diabetes if you are African American and Alaskan Native, American Indian, Asian American, Hispanic or Latino, if you are a native Hawaiian, or if you are a Pacific Islander. You're more likely to develop type 2 diabetes if you have high blood pressure, if you have a low level of HDL cholesterol or a high level of triglycerides. You're more likely to develop type 2 diabetes if you have a history of gestational diabetes or of giving birth to a baby weighing 9 pounds or more. You're more likely to get type 2 diabetes if you're not physically active, if you have a history of heart disease or stroke, if you have depression, or if you have polycystic ovary syndrome. Looking at this list of risk factors, which are factors you can change? And how can they be changed? Research shows diabetes can be prevented or delayed for those diagnosed with prediabetes. This is great news. The first thing a person can do is lose weight if they are overweight. Studies show that diabetes risk is lowered by losing just 5 to 7% of body weight. For a 200-pound person, that's a weight loss of 10 to 14 pounds. Making healthy food choices and exercising regularly can also help. Aim for at least 150 minutes of moderate intensity aerobic exercise each week, plus strength training at least twice weekly. Research shows strength training is very effective, both for helping diabetes manage their blood sugar and for helping prevent or delay diabetes for those at high risk. Early detection and treatment of diabetes can decrease risk of developing the complications we discussed earlier. Type 2 diabetes most often develops in middle-aged and older adults. And for some people, the symptoms are so mild they don't even notice. Type 2 used to be called adult onset, and type 1 diabetes was called juvenile diabetes. But due to increasing rates of childhood obesity, younger people are being diagnosed with type 2 diabetes also. Common symptoms of diabetes include urinating often, feeling very thirsty, feeling very hungry even though you are eating, extreme fatigue, blurry vision, having cuts and bruises that are slow to heal, and also tingling, pain, or numbness in the hands and feet. A person with diabetes can go undiagnosed for several years. Healthy adults should be screened for diabetes at least every 3 years using a fasting blood glucose test. Youth and adults with certain risk factors may need screening more often and should talk to their healthcare provider. Experts recommend routine testing for type 2 diabetes if you are age 45 or older, if you are between the ages of 19 and 44 and are overweight or obese and have one or more other diabetes risk factors, or if you're a woman who had gestational diabetes. We'll wrap up this module by talking generally about how to prevent chronic disease. You may have noted by now that prevention of the three main chronic diseases we discussed, high blood pressure and stroke, heart disease, and diabetes, are largely the same. Looking at this list of lifestyle modifications to prevent chronic disease, are there any modifications that belong in the things you can't change category? The answer is no. All are lifestyle modifications. But an individual's ability to make these changes may be influenced by factors outside their control. There may be significant barriers to making these changes. Recall from earlier modules that we touched on the social ecological model. We discussed how things that appear to be an individual's choice are also influenced by our family and friends, the environment we're in, and the choices made available to us. This may be influenced by the resources in a community. Most people know that having good health involves a healthy diet, regular exercise, and not smoking or using tobacco. These are also key strategies to prevent chronic disease. But still, we have rates of high blood pressure, heart disease, and diabetes that are too high. Knowing what to do is not enough to change behavior. The big question we might consider, as we are being trained as volunteers with an aim to improve community health, is why? And what is our role in helping to address these issues? The answer may lie in the social ecological model. So as we close, let's consider the social ecological model. We've talked a lot about individual behaviors for chronic disease prevention. Think beyond the individual. Reflect back on the social determinants of health. What else might address chronic disease? And how might this fit with well-connected communities? Thanks for completing this module on chronic disease, common causes, and simple strategies.